What exactly is cosmetic surgery? Why people want those surgeries? Can you just tell me in short?
With the advancements in the technology these days, with the social media, people are getting more aware. So now the cosmetic surgery is no longer a taboo, and people really want to invest onto themselves to improve their self-confidence and to improve their appearance.
Like, is it really safe to undergo these cosmetic surgeries nowadays?
I would agree that it is not.
A basic question which comes to everyone's mind is how safe are these surgery? Because before going under knife.
So if we talk of the safety, so the most commonly associated myth with cosmetic surgery is that people think that the plastic surgery is a scarless.
How is the recovery like? How many days usually it takes? Is it like a painful recovery or it's a smooth recovery? Because
Yes, there will be moderate pain for 4 to 5 days, and
or any risk associated with the surgery, so that they should be aware about this before going ahead with surgery. Are there any complication risk of this surgery?
So whenever I've been asked this question, even in my OPD during my consultations, and I always tell this to everyone that
Namaste everyone, welcome to another episode of podcast today. This is a podcast where we identify a medical topic, try to simplify it with the expert for general people's understanding. Today's topic is very interesting topic. It's cosmetic surgery. It's like a blend of art and science in medicine. And I'm very happy my friend Dr. Anshu is joining today for discussion. She's going to clear some conceptions and misconceptions about cosmetic surgery. She is a qualified cosmetic surgeon for last 10 years, and currently she is practicing in Dubai. Welcome Dr. Anshu to today's podcast.
thank you, Dr. Amitabh, for giving me this opportunity to clear all the doubts and myths associated with the cosmetic surgery.
So Dr. Anshu, let's start with the topic. What exactly is cosmetic surgery? Is it same like plastic surgery? Because I thought probably everything is same. Is there any difference? Can you just tell us what is the difference, or whether it is same?
So, plastic surgery is a wide specialty which includes two subspecialties, cosmetic surgery and reconstructive surgery. So, reconstructive surgery entails the procedure that helps in restoring the function and the form after trauma, if somebody has sustained burns, or there are congenital anomalies like cleft lip, cleft palate, there can be joint fingers like syndactyly, polydactyly. Sometimes after the breast cancer surgeries or in other parts of the body, there can be reconstructive surgeries which are required later. So that basically is the reconstructive surgery.
Okay.
Whereas cosmetic surgery is that part of the plastic surgery that helps in enhancing the appearance of a person. Like breast reduction, breast lift, breast augmentation, liposuction, tummy tuck, facelifts. And this basically helps to improve the self-confidence, to improve the concept of, to give a positive self-body image concept.
Understood. Very, very, very simplified. So, what are the common 2 or 3 cosmetic surgeries which are done nowadays, and why people want those surgeries? Can you just tell me in short?
So the most commonly performed cosmetic surgeries these days are liposuction, tummy tuck, breast augmentation, blepharoplasty, facelift. With the advancements in the technology these days, with the social media, people are getting more aware. So now the cosmetic surgery is no longer a taboo, and people really want to invest onto themselves to improve their self-confidence and to improve their appearance.
Yeah, that was very, very informative and in brief. So, a basic question which comes to everyone's mind is how safe are these surgery? Because before going under knife, especially for appearance and all, when someone is actually not sick or diseased in our language, Uh, like, is it really safe to undergo these cosmetic surgeries nowadays?
Yes, I would agree that it is not a medical illness. Getting a cosmetic surgery done is more to do with improvement of the appearance. Well, that's not 100% correct. There are conditions wherein the cosmetic surgery also helps in improving the function. For example, if we talk about breast reduction, females who have an overly large breast, they suffer from neck pain, shoulder pain, they are not able to maintain hygiene, there are rashes underneath the breast, and in these conditions, if you're going to do breast reduction, definitely the overall appearance is going to become more proportionate, the appearance will improve, but not only appearance, they will get rid of the shoulder and the neck pain associated with the heavy breast. So if we talk of the safety definitely should be given the priority. Whenever you're choosing your plastic surgeon, you have to see about the number of years of experience the doctor has in that particular procedure. You can always review the pre and the before and after pictures. You can go through the Google reviews. There are patient testimonials that you can look through, and you should always have a detailed consultation with your plastic surgeon, and you need to understand the risks and complications associated with the procedure. So definitely the safety should be the priority, and if you are following these steps, I think it is quite safe nowadays. Cosmetic surgery is quite safe.
Yeah. So this is very reassuring to know that it is not just about the self-confidence, but sometimes there may be some associated symptoms related to the problem, and it will not just boost your confidence but try to help in some medical issues which can be associated in future. Yeah, that's very important. So coming to the basic or last question related to cosmetic surgery, what are the common conceptions, misconception, we call it as a myth, in cosmetic surgery, which like you think all of us should know or general person should know?
So the most commonly associated myth with cosmetic surgery is that people think that the plastic surgery is a scarless thing. Well, one should understand that scar is the end product of wound healing. Whenever you're going to get the surgery done, there is going to be a scar. But whenever a plastic surgeon or a cosmetic surgeon is placing a scar, we take into consideration certain things. It is given in the hidden areas, it is given in the natural creases of the body so that it is well hidden, and there is a good scar protocol that can be used to fade the scar and to make it look very thin and imperceptible. The other commonly associated myth with cosmetic surgery is that people think it is just meant for women, but that's not true. The procedures like liposuction, tummy tuck, breast reduction can also be done in males. And I've had many instances when young boys, they are being bullied for having the man boobs, which is known as gynecomastia. So procedures like liposuction and gland excision for the man boobs is really a quite gratifying procedure. So it is not just catering to the females, but cosmetic surgery is also meant for males.
Yeah, that's very important, and most of us should understand that it's not just for females, even males or boys may need cosmetic surgery, and they should avail to boost their confidence. Now, coming to what you said, tummy tuck. I heard a lot of murmurs about tummy tuck. Is it same as liposuction? What is tummy tuck?
So tummy tuck is a procedure which is definitely not same as liposuction. People generally get confused between the two procedures. So let me first explain you what is liposuction so that you can understand what's tummy tuck. Liposuction is a procedure in which we give small incisions in the hidden part of the areas of the body, and we remove the excess stubborn fat from particular areas like your tummy, your back, your thighs, arms, chin, so that all the stubborn fat can be removed using special instruments called cannulas. So there are small holes which are being made, and using the cannulas we take out the excess stubborn fat, and this is known as liposuction. Whereas tummy tuck is a procedure in which there are 4 steps which are involved. One is liposuction. Second, whenever there is loose hanging skin in the tummy, it can be either because of after massive weight loss, which can be seen both in males and females, or it can be after multiple pregnancies. Then in such cases where there's a lot of loose skin in the tummy, we need to remove it. So we excise the loose skin. in tummy tuck. The third thing that we do in tummy tuck is tightening of the abdominal muscle. Like after pregnancy, it is seen that there is separation of the muscles which happens. That's why there is a laxity and there is a bulge in the upper abdomen. To improve that, we do the tightening of the muscle. So these combination of procedure and repositioning of belly button. So this combination of procedure is known as tummy tuck. Tummy tuck is an excisional procedure. We are cutting the skin, whereas in liposuction, we are just taking out the fat.
Yeah, so this is very simplified discussion that tummy tuck is not just liposuction, but it is one of the thing, and there are a lot more things in addition to liposuction in tummy tuck. So then, who is the ideal candidate? Can anyone with a fat should go ahead with tummy tuck? Is there anyone who should be avoiding it? Like, do you recommend that certain group of people only should go for tummy tuck, or anyone who feels like going it should go ahead with tummy tuck? What is your take?
So yes, the most important thing that one has to understand is both for tummy tuck and liposuction that these are not the weight loss procedures. Liposuction should be done when people are struggling to get rid of the stubborn pocket of fats and they are in a healthy state and they are not overweight. The BMI should be within 35 to go ahead with liposuction. And tummy tuck should be done in those who have a lot of loose skin in their tummy after pregnancy or after massive weight loss. So BMI plays a role in deciding whether you can go ahead with the cosmetic surgeries. You should have a BMI of less than 30 for tummy tuck. For liposuction, it should be less than 35. And other than that, you should be in a good general health before undergoing any cosmetic surgery.
Yeah, that I understood clearly. So then, suppose if someone goes ahead with a tummy tuck surgery, now how is the recovery like? How many days usually it takes? Is it like a painful recovery or it's a smooth recovery? Because since the people are going more for cosmetic purpose, they may not be wanting a painful recovery or a complex recovery. So is the recovery smooth in these people, or is there anything they should be watching for when they are recovering?
So I would not say that tummy tuck is a painless procedure. Yes, there is some amount of pain which is associated with tummy tuck, but it is worth it. So immediately after the surgery, you're going to feel pain which is easily manageable by the IV, the intravenous painkillers which will be given in the hospital. You are supposed to, you will be staying overnight or 1 to 2 days in the hospital, and during that time the pain will be well managed, and even at the time of discharge we give very good painkillers which will cover the pain all round the day. Yes, there will be moderate pain for 4 to 5 days, and gradually it subsides, and within a week you are quite well. You will be able to cope up with that, and once you start seeing your results, you will think that it's really worth it.
So there is no gain without any pain. So this is very important to know that it's not completely painless. Little bit of pain will be there, but as Dr. Anshu has said, it is worth bearing that pain. Now another question which comes into my mind is it like a once in a lifetime surgery? Like once it is done, is it done, or it can come back, or is it possible that he may need it again in future?
So not only for tummy tuck, for any cosmetic surgery, if you want to maintain the results, you have to follow a healthy lifestyle. Once you've got the tummy tuck done, you need to maintain your weight. And if suppose you are planning for future pregnancies, generally what I suggest to my patients is to complete their family and then go ahead with the tummy tuck procedure, so that the changes that can happen in the body during pregnancy, because the hormonal changes, the weight, so the changes that happens in the skin due to weight gain would be there. So once you complete the family, you can go ahead with the tummy tuck, and once you do tummy tuck, you maintain healthy lifestyle, the results are going to be long lasting, and yes, you don't need to get it done every now and then, maintaining good weight.
Yeah, so this is also very important for all of you to know that surgery is not the only treatment option for all the cosmetic problems. So you need to improvise your lifestyle. Otherwise, it may be needed again, but if it is required, it can be done, it should be done. Now, coming back to the most important and probably the last question for today's discussion. Are there any complications? Because most of these people would want to go for this surgery for a cosmetic better appearance. Are there any complications associated with it or any risk associated with the surgery? So that they should be aware about this before going ahead with surgery. Are there any complication risk of this surgery?
So whenever I've been asked this question, even in my OPD during my consultations, and I always tell this to everyone that there's always some complication that is associated with any kind of surgery. Even the normal delivery is associated with certain risks. So as I say that even with tummy tuck, there are basic set of risks and complications that you should know prior you decide that you want to go ahead with this procedure. So the basic set of complications like bleeding, infection, collection of blood, collection of water, which is known as seroma, some asymmetries, there is a scarring, hypertrophic scar, keloid, hyperpigmentation when the scar gets a little more black, stretching of scar. These are the basic set of complications involved with tummy tuck. Okay, and then there can be more serious risks like when the flap gets necrosed, there can be some healing issues if somebody is a smoker or diabetic. In that cases, it can be even more. So yes, your general checkup is very important before undergoing the procedure. And what is more important is even if there are some complications happening, they are all manageable and they can be well managed, and there's not serious life-threatening things associated with it.
Thank you, Dr. Anshu, for explaining everything in simple language. Now, viewers, please remember, it's a cosmetic surgery. Definitely, it is for better appearance. But yes, there will be some risk associated with any surgery in medical science. So you need to understand the risk and the complications associated with the procedure. Today, Dr. Anshu came to us for discussion. She clarified some doubts about cosmetic surgery, plastic surgery, tummy tuck, various others. I'm sure she will visit again to discuss some different surgery or different aspect of this cosmetic surgery. The purpose of this podcast is to give you honest and authentic information directly from the specialist in that field. So viewers, please, if you have any questions, if you have any comments, you can put it in the comments box. If you have any topic suggestions in future, definitely you can mention in the comments. And thank you for viewing today's podcast. Thank you very much. Thank you, Dr. Anshu.
Thank you, Dr. Amitabh.